Hey, Dr. Osborne here. We have a question today from viewer Rachel. She wants to know, what are some natural ways to help with osteoarthritis, joint pain, if you will? So there's a lot that can be done for osteoarthritis, but I will say many people turn to the supplement counter too quickly. Like they turn to the glucosamines, they turn to the MSMs, and they're trying to basically mitigate the inflammatory pain. But what should actually be done first, if you're struggling with osteoarthritis, is movement. Remember this, cartilage, which is what lines your joint structure, does not have a blood supply. The way it receives its nourishment is through movement. And so if you are guarding because you're hurting, which is what a lot of people do, their knee hurts so they don't walk, right? Their elbow hurts so they stop playing tennis or they quit doing what bothers their elbow, whatever that joint is, wherever that pain is. When you stop using the joint deteriorates faster due to malnutrition because it can't get the oxygen and the blood flow, and it can't get the nutrients that it needs to heal and recover. So movement becomes a critical element first. So what should you be thinking about? Well, if it hurts too much to move, you've got to start with what's tolerable. So light movement, stretches, mobility, even work in like a low gravity, like a pool environment. If you've got a whole body vibration unit, those are great tools. Some people do foam rolling movement where the foam rollers where you can roll out certain joints. That helps to increase the circulation, the oxygenation. Some people get soft tissue work like myofascial release. These are all great strategies, physical strategies to get your joint mobilized and moving again. I'd also suggest you find a really solid chiropractor because sometimes the joint is locked and restricted and it's not moving, and a good chiropractor can adjust that joint and get mobility and motion back into it. So those are physical strategies I would highly encourage that you attempt before going to that nutritional supplement shelf and just tackling all the anti-inflammatories. Now, from my experience, if you've done all those things already and you're still somewhat struggling and you need some anti-inflammatory effect with some great nutrients that will support you, number one, hands down, is combining vitamin C, high doses, for an adult, 150 pounds or more, 5 grams of vitamin C mixed with a couple of grams of quercitin. Like that combination is very, very powerful for helping support a healthy inflammation response. So those are areas that I would try. Another supplement that I highly recommend, I wrote about this in No Grain, No Pain in Chapter 7, for those of you who'd like to have the long list of supplements that I recommend to support pain, is fish oil, omega-3, but it's got to be concentrated fish oil. If you buy this stuff over the counter that has 100 or 200 milligrams, that's not going to do a whole lot for you. You need concentrated EPA and DHA, and you need to get that dose up to around 2 to 4 grams a day, kind of as a minimum, to have that inflammation support effect that you're looking for. So those are some quick, easy strategies. If you want to learn more about this and do a deeper dive, you can check out some of my other videos on arthritis and inflammation. You can also check out No Grain, No Pain. Again, Chapter 7 focuses on all the big supplements that I've used over the past 20 years in my clinic to help people with healthy inflammation support. So thanks for tuning in, and Rachel, thanks for writing your question in. Look, if those of you that are watching have other health questions, or if you need clarity or elaboration, or just have a struggle that you're not getting an answer for, send us over an email, glutenology@gmail.com, and we'll do our best to create a video answer for you. And as always, make sure you subscribe below and tune in every Monday night to Pick Dr. Osborne's Brain live, where I take all of your toughest health questions in a live forum. This is Dr. Osborne wishing you excellent health. Have a great day.